Hello, my dear students. Welcome once again to Zenith Academy Online. My name is Fatema Vhora and I am your science teacher for today. So let's begin with General Science of Class 8th from Maharashtra State Board syllabus. Today we will be studying the chapter Health and Diseases. Now, this chapter is very important. It is mainly concerned with our health and various and common diseases that we face in day-to-day life. Let's get started. So, my dear students, the first and most important question that arises in our mind is what is health? What do we understand with the term health? Now, health is a state of complete physical, mental, and social well being, not merely the absence of any disease. Means that when you say I am physically fit, it means that your body is fit and free from any kind of disorders, illness, and diseases. But what do we call about mental well-being? Mental well-being is staying away from all kind of stress, anxiety, and depressions. Social well-being is that when you get along in the society with other people, you're confident, you don't have any issues or problems in getting along with the people. That is called a social well-being. Now, when all these three terms together are present in a positive way in you, means you are physically fit, you are mentally fit, and you are socially fit, and you get along well with people, that is called that your health is good and you are a healthy person. So health is just not merely absence of disease. Now, I don't have any disease right now. I am not detected with anyone, but I don't get along with people. I stay tired all the day. I feel frustrated. So that is also a kind of mental disorder. Means I have some issues with me. So I am not healthy. Okay. So when you call healthy person, or what you mean to say by health is all these parameters are combined and they all should be in good condition. Now, when we move ahead, we see what is disease. Now we know what is health. Health is well-being. And what is disease? Disease is a condition of disturbance in psychological and physiological processes of our body. These two terms, physiological and psychological. These two terms are important over here. Now, what do they mean? Physiological is related to our body. Physio is physical well-being is physiological, related to the body. And psychology is related to the mind. So psychological well-being is related to the mental well-being of any person. Next, we move on to types of diseases. Now, we already know what is health. We already know what is disease. Now, there are infinite number and various types of diseases. So how do we classify? How do we understand that what are the types of diseases? Okay, let's move ahead. Now, you must have heard the names of various diseases like diabetes, common cold, asthma, Down syndrome, heart disease, gastritis, orthopedic diseases, and etc. 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 There is a huge list. If we count all the diseases, we take a lot of time over here. Okay. So, now all these diseases, how they are classified? They are classified based on their reasons. Reasons means symptoms. Why this is happening? What are the symptoms? Like if I have a particular disease, first of all is reason why that disease has happened to me. Second is symptoms. Symptoms, after that disease has infected me, what symptoms am I showing? Am I having fever? Am I having cold? What symptoms I have showing? So all the diseases, some symptoms might be common and some symptoms might be different, due to which we can perfectly understand that what kind of disease it is. Okay, so now we move ahead and see the types of diseases. See, here there is a picture, a depiction of how the diseases can be classified in our body. To bring coordination of scientific studies is now diseases, medicine is a huge branch, huge field in science. So to study the entire sciences, entire diseases, the diseases are classified into various forms. Now some diseases are age related. As we see over here, we can see this section is age related diseases. Now age related, what does it mean? It means that when our body gets old, aging of the body, the process of aging starts, and number of diseases affect us. Now these are neurodegenerative disease, neurological diseases, stroke, sometimes people get heart stroke, it is a brain stroke, or Alzheimer's, and other bone related diseases also due to age, because calcification of bones happens, weakness is there in the bones, that is why. The next one is neoplastic. Neoplastic means it is related to the muscles or the organs in the body where tumors can be found, or neoplasms, or such kind of infections can happen in the body. It is near the lungs, the mammary glands, the liver, and all these things. Next is infectious diseases. Infectious disease is very broad and it can happen to anybody. Now, infectious diseases are due to bacteria. Infectious diseases is due to the bacteria, due to viruses, and it affects other people's also. Like it is infectious, so when I sneeze or touch anybody, it can be contagious. So that is why this picture of human is shown over here, that it is contagious or it might be non-contagious also. Next is inflammatory. Now inflammatory is related to the muscles and bones, like fibrosis, rheumatoid arthritis, and such kind of diseases. Then next is metabolic. Metabolic is related to the functions of our body. Liver functions, intestine function, the gastric glands, uh, such kind of diseases are metabolic, where the effects of these diseases are obesity, high fat level, cholesterol level increases, etc. Now, in the inner circle of this picture, we say inflammation, origin, and local environment. Time. These four are the reasons why we get diseases. It can be time, as we saw that diseases can be age related, that is why time is given. Okay. The next is inflammation. Inflammation means some body cells get ruptured, get inflamed, and that is why they are affected. An infection enters our body and we get diseases. Next is origin. Now, origin means some diseases or some disorders, some illnesses there through origin, means through birth. It might be genetic also. And next is local environment. This is the main factor, most important one. It can happen to anybody. As we have just come out of the phase of this coronavirus, so their local environment was the main problem. That is why we had lockdown and we were confined to our homes, right? So dear students, I hope this basic is clear, and now we move to the main classification of diseases. Now, types of diseases. So here we can see that diseases are classified according to the duration and according to the reason. What does the duration mean? Duration mean chronic and acute disease. Chronic is the disease which takes a very long time to cure. And acute diseases like common cold, fever, where we take antibiotics and medicines for 4-5 days and we are fit again. Whereas chronic diseases means that diseases like cancer or something which take a long time to get cured. And now next one is according to the reasons. Now according to reasons also, they are again classified into two types. hereditary diseases and acquired diseases. Now, hereditary diseases are something that we get inheritance from our parents or family. It is genetic. It is inherited. Now, sometimes mutation of genes occur. So, Down syndrome, hydrocephalus, diabetes, these are hereditary diseases. And what are acquired diseases? Acquired diseases that we acquire in our day-to-day life. Now, it is again classified into two, infectious and non-infectious. Now, infectious means infectious diseases like common cold, flu, dengue, malaria, which is contagious. Infectious means if I have, I can pass it on to someone else also due to the common pathogen or the transmitting agent. And non-infectious diseases is something that even only I can have and I cannot pass it on to anybody else, like diabetes, heart diseases, lung disorders. Then if I have diseases like bone problem or ligament problem, and all these things are non-infectious. Now, you might have been confused that I took the name of disease diabetes in hereditary also and in acquired also. How is that possible? Diabetes 99% is always acquired. It is a lifestyle disease. Means if you don't have control on your eating habits, your lifestyle changes. Lifestyle is a very lazy kind of lifestyle. You don't exercise. You take a intake. Your sugar intake is a bit on the higher side. Then you might have diabetes. But there are some cases in which diabetes is hereditary. Means if your family members already have or are suffering through diabetes, there are high chances that even you could be a patient of diabetes. So we just saw the types of diseases, and we now start with the first type of diseases, that is infectious diseases. Infectious diseases spread through contaminated air, water, food or vectors. Now vectors are the animals or human beings that carry the pathogen, and when the other person comes in contact with those animals and human beings, they are also infected. So these animals and animals and insects or human beings that carry the virus or pathogens are called as vectors. Now there are two modes of transmission: general transmission, which might occur through air, water and animals, and human to human transmission means one infected human touches to other infected humans, or water droplets, cough droplets, uh, or the contaminated breath is taken in by the other healthy person. The other healthy person also might get infected. Let's move ahead. And yeah, so tuberculosis is caused by Mycobacterium tuberculosis. From the name tuberculosis, we get the name of the disease tuberculosis. It is caused by spitting of the patient through air. It is in air. It means the pathogens might be in air, and prolonged contact with the infected person or patient. Symptoms are chronic coughing. You have extreme coughing. You have sputum in your blood. You have blood in your sputum, and difficulty in breathing. Also, the preventive measures and treatment like BCG vaccine. This vaccine is a preventive measures and given to all the newborns when they are born in the hospital itself. And another preventive measure is isolation of that patient along with medication. Dot is a tuberculosis medication, and nowadays it is provided free of cost in many of the government centers. The next infectious disease is jaundice. Jaundice, hepatitis B, or we also call it as yellow fever. It is caused by hepatitis virus. Now, hepatitis virus are of 5 categories: A, B, C, D, and E. Any one of it might cause jaundice. The mode of infection is contaminated water, sharing of needles, like if I have been injected and the same needle is used by other person, there might be chances that the pathogen of jaundice might enter from me to that other person. And blood transfusion. Symptoms are anorexia, yellow urine. The entire body of the infected person becomes pale yellowish in color. The urine is dark yellow in color. The patient has weakness, nausea, vomiting, and gray color stool. Stool is the waste product of the human body. Prevention and treatment. Prevention is drinking boiled water always, and maintaining proper hygiene, cleaning of hands and other sanitary habits also should be very hygienic. Let's move ahead to the next disease, that is dysentery. Now dysentery mainly is like having very watery stools, loose motions, and vomiting. Okay. Now here the pathogen or the bacteria, it is caused by bacteria also and virus also. Shigella, bacilli, entamoeba histolica, this is one name. Entamoeba histolica is the name of a bacteria that causes dysentery. All these 4 or 5 bacteria can cause dysentery. Main mode of infection is contaminated food and water. Now symptoms are watery stool, pain in abdomen, heavy stomach pain and watery stools. Prevention is drinking boiled water, proper storage of food, and ORS consumption. What is ORS? ORS is oral rehydration solution. When you have watery stools or you vomit a lot, the entire water gets dehydrated from your body. To maintain that water balance in your body and retain all the important minerals and salts, ORS is given. The next disease is cholera. Cholera is caused by Vibrio cholerae. It is a bacteria. Again here the name of the bacteria, cholerae. It gives the name of the disease also, cholera. The contaminated food and water is the mode of infection again. Symptoms, vomiting, severe diarrhea. Diarrhea is having loose motions, cramps in legs. Now, in the previous disease, dysentery, we saw that there was pain in abdomen. Here it is cramps and pain in legs. Prevention and treatment is following hygienic practices, avoiding open place for food, drinking. Means we should not eat the food that is kept in an unhygienic manner, like open in an open place or uncovered food and water. Then always drink boiled water and take vaccination against cholera. It is available in all the medical centers. Next one is typhoid. Typhoid is caused by Salmonella typhi. It is a bacteria, Salmonella typhi. Okay. Here also the name of the disease typhoid comes from the name of the bacteria typhi. Contaminated food and water is again the main source of infection. Symptoms are anorexia again, headache, rash on abdomen, dysentery, and the main thing is fever up to 104 degrees Celsius. It is a very high fever. This degree is called as above the normal level of fever. Treatment and prevention is drinking clean water, vaccination, proper disposal of sewage. Because sewage or garbage can be breeding grounds for many kind of bacteria and viruses. The next one is, this is during present times, common diseases that we face during the present times. The first one is dengue. Dengue is caused by mosquitoes. Mosquitoes lay their egg in the waterlogged places, that we also know. Okay? Now dengue is caused by this mosquito called as Aedes aegypti, and the virus that is present in this mosquito, the causative agent is the 1014 virus belonging to the type flavivirus. As we know that malaria is caused by Anopheles mosquitoes, dengue is caused by Aedes aegypti mosquitoes. Let's see the life cycle and the transmission cycle. Now this is the dengue transmission cycle. How is dengue transmitted? This is uninfected Aedes aegypti mosquito. When it comes and bites the person who is already infected with dengue, the through blood, the pathogen, the virus enters the body of the mosquito. Now this mosquito has become infected with dengue. Now this mosquito goes and bites other people and infects the healthy person also. This is the dengue transmission cycle. And here on the other hand, we see the life cycle of mosquito. Mosquito lays eggs, then eggs for become larvae, larvae grows and becomes the mosquito again. This is the life cycle of mosquito. You can take a screenshot and keep for future reference. Symptoms of dengue are acute fever, headache, vomiting, pains in eye socket. Now this area around the eyes is called as eye socket. So pain in eye socket and prominent is a very prominent symptom of dengue. Decreased platelet count. Whenever we have fever for more than 3-4 days, the doctor will suggest us to take a blood test. In that blood test, they look for WBC count and platelet count. If that platelet count is less and WBC count is more, they lead to internal hemorrhage, and that is why the medication to be started immediately for such kind of diseases. Preventive measure is cover all the storage containers, use insecticides, breed small fishes, throw away water containers. Don't store water for longer period. It may become a breeding ground for water larvae and of mosquitoes. Then we should clean the drain areas always, apply mosquito repellents, wear long and bright color clothing, because by dark color clothing, they attract insect towards us, mainly mosquitoes. Then set up mosquito trap. There are n number of mosquito repellents and mosquito traps available in the market nowadays. Close all the windows, use net for baby cots because babies have to be protected the most. Let's move to the next disease, that is called as swine flu. Now, swine flu occurs mainly through pigs and humans. Now, pigs are the carrier of this vector or virus that is responsible for the swine flu. Now, swine flu floods through the secretions of nose, throat, and saliva of the animal. These are the symptoms of swine flu. Systemic symptoms: fever, lethargy. Lethargy is feeling lazy, no energy at all, feeling tired all the time. Runny nose, sore throat, pain in muscles, pain in joints. Intestinal, the symptoms are like you can have diarrhea, nausea, vomiting, coughing, lack of appetite, means no, you don't feel like eating anything. The main symptoms are difficulty in breathing, sore throat, and body pains. Let's see the diagnosis of swine flu. Diagnosis is not just done by looking at the symptoms. For proper conclusion that a person is having swine flu, the liquid from the throat is taken and sent to the laboratories. Now these are the two laboratories of virology in India. The liquid is sent to this laboratory and the test is run, where we can conclude that confirmation is done over there, that whether the person has swine flu or not. Let's see the fact file. The first case of swine flu was reported in Mexico in 2009. Okay? And it was caused by influenza virus. H1N1 is the name of that virus. Person who come in contact with pigs or eat pork can have swine flu. So my dear students, let's start with this disease now, that is AIDS. AIDS is acquired immunodeficiency syndrome. Now, AIDS is very common. I hope you all know about it, but let's have a look at it in detail. Acquired immunodeficiency syndrome means that the disease is not related or confined to one particular organ. It is acquired immunodeficiency, means the entire immune system becomes deficient, becomes weak when you are infected with AIDS. This disease is caused by human immunodeficiency virus. HIV is human immunodeficiency virus. Means this virus attacks the entire immune system of the person. In this disease, the victim suffers from various diseases due to progressive weakening of the natural immunity. Now, diagnosis of AIDS cannot be confirmed without tests in medical laboratories. ELISA test is used for its proper diagnosis. Symptoms of AIDS are person specific. What does this mean? It means that without any medical proper test, you cannot say that a person has AIDS. Why? Because the person may have loose motions, person may have dysentery, like high coughing, anything. So that cannot be conclusion that he has AIDS. The name of the test which can conclude whether AIDS is present or absent is known as ELISA. And all the symptoms of this AIDS disease can vary from one person to another. Let's move ahead. AIDS does not occur due to touching or sharing food with infected person or by nursing the HIV patient. Nursing means taking care. तो हाथ लगाने से ये नहीं फैलता. Okay? Our behavior or our outlook towards the infected person must always be normal. HIV was first reported in African species of monkeys according to the National AIDS Control Program and UNAIDS. 80 to 85% HIV infections in India occur through unsafe sexual contacts. We are well aware what sexual contacts are, but if we do not take proper precautions while having sexual contacts and have sexual contacts with those those who are infected with AIDS, there are high chances that we might also get infected with this disease. I hope this concept of AIDS and other infectious diseases are clear up till now. Let's move ahead to the infections through animals. Infections or diseases that spread through animals as vectors. First one is rabies. Rabies is a viral disease. Okay, it occurs due to the bite of infected dog, rabbit or monkey. Infected means these dog, rabbit or monkey, they might be infected with the virus which is responsible for the disease rabies. Virus enters the brain via neurons. Hydrophobia means you get fear of water, is one of the important symptom of this disease. Means if a infected dog that is infected with rabies has bitten me, the first thing is I will run away from water. I will stop drinking water. Rabies is a fatal disease. Okay, in this case the victim or the victim of the disease shows extreme fear for water, and if we don't drink water, then obviously it is life threatening. So however, fatality can be prevented by timely vaccination. Even if you have a dog bite, there are a series of injections to be taken. Why? Because we have to avoid rabies. So before the onset of symptoms, before any such kind of symptoms start, before that virus reaches your brain, we have to start the treatment. We have to start taking the vaccination and injections. Now symptoms start to appear within 90 to 175 days of dog bite. Okay, it does not start immediately. It takes a incubation period in your body. The virus grows first in your body and then the symptoms will appear. The symptoms of rabies are fever for 2 to 12 weeks, exaggerations in behavior means the person might show very hyper-rated behavior, very dull behavior sometimes. Means it is unpredictable. Next one is hydrophobia. As we saw, the hydrophobia is the fear of water. Okay, so these are the symptoms of rabies. The next one is non-infectious diseases. Till now, we have studied the infectious diseases, which may pass on from one person to other or animal to human beings through different kind of vectors. Now we are seeing the non-infectious diseases. Diseases which do not occur through infectious and body contacts are called as non-infectious. Such diseases arise in human body itself due to certain reasons, that may be time, age, and different reasons. I alone might have that disease. If I have, it is not necessary that my children will have or my other family members will also have. Now, which are these diseases? First one is cancer, the most important and dangerous one that we are hearing of it day to day and night. Nowadays, many people get affected by cancer. Now, what is cancer? Cancer is the uncontrolled and abnormal cell growth. We have small cells in our body, everybody knows, but the growth of that cells are limited and confined, and in a proper disciplined manner they are controlled. एक टाइम पे अगर 1000 सेल बनने हैं बॉडी में तो उतने ही बनते हैं, but when these cell keep on growing and growing uncontrolled manner, abnormal manner, then it is called as cancer. Group or lump of cancerous cell is called as malignant tumor. Cancer can occur in various organs in the body, and it can also occur in the tissues like blood. It can occur in lungs, mouth cancer, tongue cancer, breast cancer, uterus, skin, and blood cancer. Okay, let's move ahead. Reasons for cancer is consumption of tobacco, gutka, smoking, alcoholism, lack of fiber content in fruits, then excessive consumption of junk food, etc. are possible reasons. Hereditary might be also a reason, but not always. So main is the lifestyle modification. Lifestyle reasons are main, and genetics. These all are the small pictorials taken to detect what are the reasons of cancer. Sometimes it is also related to occupation. Like if there are chemicals or aerosol that you breathe and breathe continuously, then your lungs become cancerous due to it. Let's move ahead and see the symptoms of cancer. Chronic cough, hoarse voice, difficulty in swallowing, means there is problem. This throat starts aching. Uncurable scare and inflammation. If there is a skin cancer or a lump form in the body, you can easily feel it. It is a scar, inflammation. It does not get healed fast. Lumps in breast. In breast cancer, the main is lumps in breast. You feel hardness, tightness. Unexplained weight loss. There is no, you even if you eat, but there is no weight gain. You have weight loss, unexplained. There is no reason for it. Now, modern diagnosis and treatment of cancer. Now, there are various treatment of cancer available. First is CT scan, MRI, mammography, biopsy. These are used in diagnosis of cancer. CT scan and MRI, these are huge machines in which they put the entire patient, they scan for the growth of abnormal growth of cells in the body. Biopsy is done to find out whether the growth or lump of cell is cancerous or non-cancerous. When once detected, the treatment is done with chemotherapy. There are chemical radiations given, chemicals given, radiation therapy is given, where high frequency radiation is given to that part of the cell, and it is finally removed or dead, killed inside the body itself, so that it doesn't grow. Surgery is also done. Where surgery is done, the lump or the cancerous cell tissue is removed. Modern techniques like robotic and laparoscopic surgery is followed. Means that it is a very small invasive. एक बड़ा cut नहीं होता है. The surgeons don't work on your body. Robots do that surgery. So these modern diagnoses are there. Treatment is there of cancer, which takes time. We have to be patient, we have to be calm, and we have to be having a strong willpower to fight diseases like cancer. Then controlled diet also helps. Now for mouth cancer and all, if you stop addictions like tobacco, smoking, alcohol, and all. So it will automatically, you know, get rid of the symptoms. You get rid of the chances that you might have cancer. Then modern treatment is beneficial. Physical exercise is there. Then you have, if you have good food, that also helps your body to grow in a better way. This was cancer. Hope you all understood about it. For any doubts, please type into the comment section and we will surely make all your doubts clear. The next one, non-infectious diseases, diabetes. Diabetes are of type 1 diabetes and type 2 diabetes. That you might learn in the higher standard. There is an insulin hormone called insulin produced in our pancreas, which controls the sugar levels in our body. Now, if the insulin is secreted in low quantity, glucose cannot be controlled in the body, and this disorder is called as diabetes, where your glucose level in the body increases indefinitely. ठीक है? तो the hormone insulin has to be regulated. तो medications जो देते हैं diabetes के लिए, these are insulin regulator medicines, and also it brings the glucose level in your bodies in under control. Symptoms that cannot be ignored is frequent urination and increased weight loss, or increased obesity. You might feel hungry many times, or then you might not feel hungry at all. These all are the symptoms of uh, diabetes. Increased thirst, increased urination, then slow healing of cuts and wounds. You cannot see properly, vision is blurred, nausea, tingling movements, like I said, vibrating movements in your fingers. These all are the symptoms of diabetes. So you should get your blood sugar tested if you feel any of these symptoms are present in you. Now, reasons for diabetes is hereditary, obesity, high. If you are obese, your weight is more, so it automatically means that your cholesterol levels are more, sugar is more in your body. Lack of physical exercise, mental stress, is these are the reasons of diabetes. Next one is preventive measures. What to do to prevent diabetes? Following proper diet, medicines, and exercise. This is the basic, and it is applicable not only for diabetes but for all the diseases. So diabetes is a lifestyle disease. If you maintain good lifestyle, you can avoid diabetes. India has the largest number of patients, diabetes patients in the world. At present, approximately 7 crore diabetes patients are present in our country. Why? Because we do not follow healthy lifestyle. I hope now you will start following a healthy lifestyle and avoid diabetes at your end at least. Let's move ahead. Next one is heart disease. Heart diseases is like when the efficiency of heart, the proper working of heart decreases due to decreased blood supply, and thereby oxygen and nutrients supply to the heart muscles. Okay? Oxygen does not reach your heart properly, and due to this you might suffer from various kind of heart diseases. Now when oxygen does not reach your heart, what happens? Your heart has to do more work in order to pump blood to the other parts of the body, oxygenated blood, right? We all know that blood pumps oxygenated blood to all the other parts of the body. So what happens is that we have to do more, the heart has to do more work, and it leads to stress. The heart gets stressed. This may cause heart attack. If someone is having heart attack, immediately the person needs to bring under doctor's consultation, and treatment has to be followed. What are the symptoms? When would you feel that you might be risk at heart attack, or your heart is not functioning well? Severe chest and shoulder pains, pain in the neck, cramps in the hand, and uneasiness, tremors. You feel tremor, you feel that. Also, reasons for heart attack can be smoking, alcohol intake, diabetes, hypertension, obesity, lack of physical exercise, heredity, anger and anxiety. Please, we have to take care of all these in order to avoid heart attack. Next one is first aid for heart diseases. First, call ambulance. Whenever you feel any person has a stroke, call ambulance. Check for consciousness. The person has to be conscious. Keep him awake by shaking his shoulders constantly. Keep the patient lying on the back in horizontal position on the hard surface. Perform compression, only life support. Compressions only life support. This is a process in which the heart is pressed so that it starts pumping again. In this, press the center thorax for at least 30 times in the rate of 100 to 120 strokes per minute. This is the first aid for heart attack. Now, heart disease, many other things are related to heart diseases like bypass surgery is there. First is angiography is done to know where is the blockage and what is the issue. Then angioplasty is done to remove that blockage. Bypass surgery is done, open heart surgery is done, pacemakers are installed for the smooth functioning of the heart. Stents are installed in the body, and also heart transplant is done in case if it is needed. Here we finish the important part of diseases, infectious, non-infectious and acquired. Now next is medicines. Misuse of medicines. Nowadays we see there is a lot of scam going on in the name of medicines. Duplicate medicines are also made and sold. Also, people who do not have knowledge of how to take medicines, they consume medicines without prescription of the doctors and therefore overdose of medicines or wrong intake of medicines have adverse effects on our body. Overdose of painkillers might damage our nervous system and excretory system, liver, etc., which may have life-threatening disease. Therefore, we should not consume any painkillers without prescription and not consume more than the required amount. Overdose of antibiotics which may lead to nausea, stomachache, dysentery, white rashes on the tongue and patches. Antibiotics always have to be consumed with the prescription of the doctor, practicing doctor. Now, next one is generic medicines. What are generic medicines? Medicines are is a huge field. Medicine is a huge field. It is a big business. There are n number of brands that manufacture different types of medicine. For one medicine, we have 3 or 4 or more than that companies manufacturing the same medicine. But now generic medicine is a new term. What is it? Generic medicine are also known as general medicines. These are basic medicines and these are manufactured and distributed without any patent. What is patent? Now whenever any company manufactures a new medicine, they patent their name and their composition of their medicine with the government, and nobody else can copy their name and that composition and make the same medicine. So that is called as patent. Now generic medicine, the manufacturer of these general or generic medicine, they do not patent their medicine with the government, and that is why that cost of manufacturing is less. Now when the cost of manufacturing is less, the cost of selling also decreases. These medicines are at par at quality, means the quality, the composition, the effect of these medicines is same as that of the branded one. Branded means the name of the company whose name is patented with the government. Like Cipla, ठीक है, Cipla है, Elchem है, और बहुत सारी मेडिसिन, डॉक्टर रेड्डीज है. I am just taking these names in order to make you understand that what are brands of medicines. These brands of medicines, Himalaya hai, these are branded, patented with the government. But the same medicines are also made at generic form, in the generic form by the normal manufacturing without patenting their name, and those medicines are available at lower cost. So production cost decreases, and due to that, the formula is readily available for others also, and due to that, the selling cost also decreases, and all normal people can afford these medicines because they are economical. Next is lifestyle and health, lifestyle diseases. Now, all the diseases are mainly related to your lifestyle. If you eat a lot of sweet, you eat a lot of junk food, unhealthy drinks, you just rest at home, you don't exercise, you are not physically active, means you are inviting more and more diseases towards you. And this is how the today's people live. They want everything, but they don't want to have a healthy life. Now, lifestyle diseases include daily routine and type of food. Nowadays, habits like staying in bed late till morning, going to bed late in the night, this frequent changes in the meal timing, lack of physical exercise, consumption of junk food, this has increased in today's time. Late night we are watching Netflix, TV, so that what happens, our sleep is hampered. We wake up late in the morning. Entire routine of the day is hampered. Next is, due to this, people get sick frequently. We don't get adequate sleep, and that is the main trigger of getting sick and inviting various diseases. So, if the frequency of becoming sick is to be lowered, people should follow the right lifestyle and proper routine. It must include sufficient sleep, right food, yogasanas, pranayam, and physical exercise. फिजिकल एक्सरसाइज शुड ऑल्सो बी एज पर वंस कैपेसिटी. नाउ फिजिकल एक्सरसाइज बोला है तो ऐसा नहीं कि आज ही एक ही दिन में हम सब कर लेंगे. आज ही वी हैव टू डू योगा ऑल्सो, वी हैव टू रन ऑल्सो ऑन द ट्रेडमिल, वी हैव टू पुशअप्स पुलअप्स सभी करना है. नो, फर्स्ट test your own physical ability, how much you are able to do, and then only you do accordingly or work out accordingly or do the exercises. If you're not that strong, you start with yoga, first meditate, first make your body strong, and then you can do with the bulkier or heavy training, heavy muscle exercises. Pranayam and yogasana should be performed under expert supervision, because if you're not trained or you are not know the techniques, you do not know the technique how to do, then it might cause problems. Important part, as we all know, is vaccination. Vaccination is important to prevent all the infectious diseases. Vaccinations are given right from birth to prevent major disease, as you know. And even if you don't know, ask your mothers. They might be having a vaccination chart in your name. Since the time you are born, there are several vaccinations given at intervals, 1 month, 2 months, 6 months, and all these vaccinations cover major diseases or life-threatening diseases, and these are compulsorily given to every kid that is born. In case if anything is missed, we should always go back and take that vaccination to prevent major diseases. So my dear students, hope this chapter has been explained well and you have understood. And here I will take a short recap and tell you all the points to remember and those points which are important in this chapter. So first is, health is a state of complete physical, mental, social well-beingness and not merely absence of any disease. Second is, condition of disturbances in psychological is mind, physiological is body. Processes of body is called as disease, means physiology and psychology both should be fit. Diseases are classified as infectious and non-infectious depending on the whether they are transmitted or they are not. If they are transmitted, they are called infectious. If they are not transmitted, they are called as non-infectious. And also again, further classification is done on the mode of transmission, like animal transmission or airborne diseases, human to human transmission. I hope you remember all the points. Next is, we learned about symptoms and preventions of diseases and causative agents, like which bacteria or viruses responsible for the causing of disease like dengue, rabies, swine flu, AIDS, cancer, diabetes, everything. We have covered all these diseases and also heart related diseases. Then lifestyle related diseases. Also, we learned the misuses of medicines, how it affects us, and which cheaper options of medicines are available in today's time. Next is we learned about vaccination, why vaccinations are important, and if in case if we have missed, we should always go back and take those vaccinations to avoid life-threatening diseases. And last one, very important, how our bit tiny changes in the lifestyle or modification in our day-to-day routine and lifestyle can prevent major diseases attacking us and infecting us. So, my dear students, hope this chapter is clear and you will take this health of yours and your family as priority and do the required changes in case if there is something missing at your end. And for any doubts, please drop a comment and we will surely get back and solve all your queries. Stay tuned for more chapters, interesting chapters and topics covered by Zenith Academy. See you soon. Thank you.